Welcome back, everybody. Hope you enjoyed your lunch break. Hope you enjoyed some delicious lunch. I think my vote is going to go for the lentil salad and the lamb. Those were my choices, but no doubt you found your own delicious food. Anyway, now just before we get on to the outstanding sessions ahead for this afternoon's plenary, we have a lost phone, or somebody has reported a lost phone. So just in case on your travels you happen to come across a black iPhone, hardly any of them around, but in case you have the good fortune to come across one without apparently an owner attached to it, could you grab it please and take it when you have the opportunity as soon as possible to the registration desk, because there's some separation anxiety going on at the moment, and it would be great to get it back to its owner. All right, as I mentioned, we have some great sessions ahead for this afternoon's plenary. First of all, we're going to be hearing about the new Aged Care Act in practice. The new Act will introduce universal provider registration, more independent, more person-focused complaints processes, and a stronger focus on the important role, really, of aged care workers. We're going to be hearing from the architects of the new regulatory framework, from the Department of Health, Disability and Ageing, as well as the Commission staff responsible for putting the concept of proportionate risk-based regulation into practice. As usual, of course, there's going to be an opportunity for you to put your questions to the panel during this session. Remember, as you've been doing, and it's been great to have so many questions flowing through, to ask a question, you can submit it via the conference app, or please do feel free to make your way to one of the microphones here in the auditorium. Now, let me introduce you to our panellists who've joined us here on the stage, and perhaps once again, as I mentioned your name, if you could give us a little wave so everyone can see who you are. But we have, first of all, from the Commission, Metz, Deputy Commissioner, Sector Capability and Regulatory Strategy. Gary Rake, Deputy Commissioner, Regulatory Operations. Michelle Bampton, Interim Complaints Commissioner. And Sarah Kelly, Acting Registrar, Regulatory Operations. And from the department, we have Katie Holm, Assistant Secretary, Strengthening Providers Branch, Quality and Assurance Division, and Robert Day, Assistant Secretary, Harmonisation and Regulatory Strategy Branch, Quality and Assurance Division. So that's our panel, and it's great that we have such a fantastic combination here on the stage this afternoon. Mel is going to take over to facilitate the session, and I'm going to hand over to her now, but please, a warm welcome for all our panellists.
Thank you so much for that introduction, Richard. Liz mentioned this morning that I had something to do with developing the new aged care legislation, so it's actually a real pleasure to be on stage with this fantastic panel of leaders who also helped shape the legislation. And for a policy nerd like me, this is a really cool panel because you get to see the whole policy cycle, right from development through now to where we're at, which is implementation. This session is really designed to be practical and interactive, so I hope that you have lots of questions for the panel. We've got a team of real experts here, so even if we sort of go beyond the topics that we've slated to talk about, send those questions through and we'll do our best to answer them. So as Richard outlined, we're going to be talking about four key features of the new framework. Universal provider registration, the improved rights-based complaints framework, the new regulatory tools and how they'll be used, which I know is of a lot of interest to providers, and worker regulation. So I'll kick off the discussion with a few questions for the panellists. And I'll start on the topic of universal provider registration. And you, Rob. So one of the ways that the new regulatory model in aged care differs quite significantly from the NDIS is that it will introduce universal registration. And can you tell us why that's important?
Thanks, Mel. And look, the concept of universal provider registration in a lot of ways goes back to the Royal Commission. And the Royal Commission found really strongly that we didn't, in aged care, take enough advantage of the opportunity of the process of bringing providers into the system to ensure that we had the right group of providers who are capable of delivering quality, safe care for older people. And he particularly pointed out the fact that we had different entry processes for different parts of the aged care system, and I didn't think that was a sensible way of going. And so universal provider registration builds on that. We move into a world where every provider delivering Commonwealth-funded aged care services has to be registered, and if you're delivering across multiple programs, then you have a single registration that covers all of those different programs. One, I think, of the advantages from a provider perspective in that model is you then have a single streamlined set of obligations rather than having a range of obligations for each of the different programs that you deliver. When you come to the process of renewing your registration, you have one application, one fee, and if you're delivering types of services that need an audit, because it is one application, there'll be a whole lot of the information gathering that's at a whole of provider level, not at repeating that process for every individual service, although the audit will go out to every aged care home. I think the other thing that's really important in the universal provider registration, and it's actually something that's identified as a challenge in the NDIS at the moment, is from a regulatory point of view, but from the point of view of older people and their loved ones and their advocates, real clarity about who is responsible for the delivery of quality care. And so in the aged care system, you can follow the dollars effectively. The organisation that gets the Commonwealth subsidy is responsible for delivering quality care in that instance. And that's clear to the person receiving care as well as to the regulator. So there's a protection there and a transparency there, but also some benefits in that streamlined set of obligations and regulatory interactions for the provider as well.
Thanks, Rob. And Sarah, you're responsible for putting this into practice now, and I know you've been doing a lot of work setting up the registration system. What will the Commission be considering when a prospective provider comes to you and asks to be registered?
Thanks, Mel. That's a great question. And just a little plug as well, if people can stick around till 4 o'clock this afternoon, I will answer Mel's question now, but there'll be a lot more information in the final session then as well. So don't duck off for a drink, stay around for the last session. Okay, so what I'm actually going to do is, partly because I so admire Mel's handiwork, but I'm actually going to read to you from the Act, because what guides us in what we look at through a registration process is literally what is written in the legislation. There's no magic to it, there's no secret to it, that's literally what is guiding us. So I'm just going to read through some of that language there because I think it really sets it out clearly for us. So the first part of the test is really predominantly around suitability. There is a requirement that there isn't an ABN, but it's really predominantly around looking at suitability. And the kind of things that we're looking at for suitability is compliance with laws of the Commonwealth or laws of the state and territories. Whether a banning order from the NDIS is in place or has been in place. Whether if they have been previously been a registered provider, whether or not that registration has ever been revoked. If the entity's previous experience and performance in delivering funded aged care services in their intended service types, their legal and business structure, including whether the entity is an entity within the meaning of the Act, and if the entity is not a government entity, the record of sound financial management, and that they have systems that they're going to use or propose to use in order to ensure sound financial management in relation to the delivery of the funded aged care services. And again, this is another really important one, that each responsible person of the entity is suitable to deliver funded aged care services, having regard to the suitability matters. So if we're satisfied with all of those checks, and again, they really are around suitability, Then what we're moving on to look at is for each of the provider registration categories that the entity wants to be registered in, we're looking at their ability to operate in those categories. So the kind of things that we're looking at is, first of all, that they actually intend to deliver the service types that they've applied for. And then we're looking at whether or not they have the commitment, capability and capacity, including through any systems that they have or propose to have, to deliver the funded aged care services, having regard to those service types. Okay, so in addition to that, if people are wanting to register into category 6, what we're also looking at is that the provider has connected to them a residential care home. So either an existing approved one or that they're seeking approval for one. And equally, if a provider is wanting to register into categories 4, 5 and 6, then we would also be undertaking an audit and looking at the outcome of audit when we undertake our decision making as well. So a lot of that information is set out, not just helpfully in the legislation, but also in our provider registration policy, which I think Liz might have referred to this morning. Also, there's information in the provider handbook. We've got some of our forms available, drafts of our forms are available on the Commission's website, and we will shortly be releasing guidance that sort of takes you through how to complete those forms, talks about the evidence for each part of the form that you can provide as well.
Thanks so much, Sarah. And it sounds like you're really working to help providers through the registration process with lots of information. And I'm sure your plug for the session this afternoon will ensure that everyone is here for the last session of the day. I'll move on now to regulatory tools, because I know this is something, the word punitive came up this morning in one of the questions, and it's something that I think some providers, particularly those who are new to regulation by the Commission, have been a little bit worried about. Rob, the new framework has a range of different regulatory tools. Can you provide us with a bit of an overview of what those tools are and why you thought it important to give the Commission those powers?
Yeah, thanks, Mel. And look, I might start with the why part first. And again, going back to the Royal Commission. The Royal Commission gave us a really clear mission statement. It said that the primary purpose of aged care regulation is to protect older people from harm. And so needing to think about what are the powers in terms of investigation and enforcement that the Commission needs to have at its disposal to both protect older people from harm when there is a risk of harm, but also to give that confidence, that assurance to people accessing the aged care system that there is an independent body that is on the job to make sure that the system is as safe as it possibly can be. The Royal Commission also, though, made a point that protection is better than response when something goes wrong, and that some of the best ways that we can support protection are by encouraging in our regulatory system continuous improvement and striving in excellence. And so we've tried in building the regulatory model to strike that balance between the measures that support protection, but also some measures that support innovation and continuous improvement and striving for excellence. In terms of the regulatory model that the new Act brings in, a couple of key differences that I'd highlight for you. First of all, the role of audit plays a very different role in the new regulatory model to the current system. Audit under the new Act is focused particularly on that process of applying to become a registered provider or renewing that registration. And it'll be a forward-looking process at how are you set up as an organisation to meet your obligations and to deliver quality care. And it's discrete from the powers the Commission that has to monitor the way that care is being delivered and to then enforce things if something is going wrong or there's a risk of harm to older people. Those kind of powers all come out of the Regulatory Powers Act, so it's a consistent set of regulatory powers across that other Commonwealth regulators have, rather than the situation we've got under the 1997 Act where the monitoring and the enforcement powers are often bespoke to individual obligations that providers have. So a more consistent set of powers both within the Aged Care Act but also across the Commonwealth regulatory system. And they're probably not powers that will surprise you. There's powers to enter and to search and to seek information as part of the monitoring powers of the Commission. And then if something is going wrong, a toolkit of things the Commission can do to try and help bring a service back into compliance with its obligations. and that ranges from enforceable undertakings, variations of the conditions of registration, infringement notices, civil penalties, right through to suspension or revocation of registration and banning from the system. And I guess just to build on that move away from punitive to a relational approach to regulation, I think also worth calling out that there are some positive powers that the Commission has under the new Act that it doesn't have under the 1997 Act. So there is, for example, graded assessment against the quality standard that will recognise excellent performance. There's the power of the Commission to grant a longer period of registration rather than the standard 3 years. And so, yes, there are some powers to respond when things go wrong. There's also some powers to recognise and incentivise continuous improvement.
Thanks, Rob. Gary, Rob's just outlined the regulatory responses that are available to you and your team. How do you decide what's fair and proportionate and reasonable as a regulatory response in particular circumstances?
Yeah, I'd start by going back to the words that Liz and the Minister used this morning, some of the descriptions they gave around us being fair and proportionate. And to sort of build that out and explain the language that we use within our own team, we talk about being as fair as possible, as firm as necessary, in that order. And if I break that down a little bit, the fair as possible bit, what we're really trying to do here is promote an environment where we get high quality, safe care. That's the outcome we're after. And our approach to regulation is to steer us towards that. So there'll be some times where we'll be able to help a provider improve their practices with simply sharing additional information, with working alongside you to see you improving standards and moving in the right direction. There'll be some times where we need to look at the use of an instruction, an order to press you to reach those standards. That comes into the firm as necessary bit. We only need to do what is necessary to get to that right outcome. There will, from time to time, and I hope it will be infrequent, there will be some times where the risk to consumers is so great and so immediate that our actions will be to move more to the enforcement end, and we might need to be looking at placing strong conditions on a provider or removing them from the sector, revoking their ability to provide services. That's very much a back end. So, fair as possible, firm as necessary in that order. I think the second thing I'd say is, in being as fair as possible, we're coming out and asking providers to work to high standards. My team and I are going to hold that mirror up to ourselves in the way we work with you. So at any time that you'd like to know more about our process or understand, feel free to ask, are we being as fair as possible? And in fact, 6 degrees of separation, you're never more than 2 clicks from finding my personal mobile number and email address. It is that level of commitment that we've got to being transparent, accountable in the way that we work. And if you'd like to see how that gets built into our governance systems, the Minister has issued a document called a Statement of Expectations. It's the guidance to Liz and us within the Commission on how the Minister would like us to exercise our powers. It's published on our website. It's in really easy to read plain English, and what it says is, chase the outcome, work with the sector to lift the standards of quality and safety in aged care, support the sector, support those who are doing their best, don't be harsh in enforcement. Save those powers for those only where there's a really serious harm or an egregious behaviour that needs to be addressed. So you can read that and see those are the rules of racing for us, and it means a lot to us that we're a partner in this and that we get those outcomes.
Thanks, Gary. I'll move on now to worker regulation. I think over the time I've been working on aged care, we've seen a lot more support for the aged care workforce, but also some expectations that have come along with that. Katie, banning orders and the code of conduct have actually been in place already for some time for aged care workers. Can you tell us a bit about what's on the horizon now for aged care worker regulation?
Thanks, Mel. The next big change, I think, is worker screening and how that will be done for the sector. So, recognising that there will be some change coming and that we'll have key partners in states and territories, we're going to do this in a staged way. So there is some change that will come on 1 November, and then the Commissioner mentioned this morning that the biggest shift, which is alignment to the NDIS sector, that won't happen until 2026. Of course, we've got big relationships with the states and territories that are contingent on that, but we're working very closely with them, and we have their commitment in principle to align those two checks. I'll talk a little bit more about the future state in a moment, but perhaps focusing first on 1 November and what we need to do to get ready for that. I mean, essentially, the same requirements of what providers need from their workers and also their what's currently called key personnel, but is given a new name in the Act. The requirements are the same. So it's having a police certificate or an NDIS worker screening check. Now, the police certificate needs to be less than 3 years old and doesn't contain certain offences, or an NDIS clearance check, as I said. So that's where people may already be working in the NDIS sector. If the worker has lived overseas for a period of time, you'll also need a statutory declaration from that person that they haven't committed any of the precluding offences. And you'll need to have records of that. So that's essentially exactly as it is now. What is changing mostly for CHSP, that's where the big change exists. So no change for the precluding offences for NATCFAC or if you're an approved provider currently. But for CHSP, those precluding offences will now match those that are attached to the NATCFAC program. And the reason we've done it in that stage way is to prepare for that lift, that bigger lift for when we will align with the NDIS and their check, the requirements of their check. So the big difference for that future state is that we'll start to work with a set of roles that are considered to be roles where you must comply, and they are what are known as risk-assessed roles, and then there'll be non-risk assessed roles. So if you're in a risk-assessed role, you'll definitely have to have an NDIS aged care worker screening check. The states and territories' role is that they will be undertaking those checks with their worker screening units. That's what they do for the NDIS now. They've got a set of expertise that is very, very helpful for this type of work. So there's consistency in decision making, and it's a national approach. It means that workers in aged care can work in the disability sector and vice versa without having to get a second check. And it means that it's a national check. It's mobile with the worker. So you can work in Western Australia with that check, or you can work in Victoria. Doesn't matter. One of the other things that we have changed for aged care, though, is that if you are an AHPRA registered worker, you won't need a aged care worker screening check because the check for AHPRA is considered to be consistent with that, and it avoids duplication and extra regulation. So your AHPRA registration would be recognised for that purpose. We have got some communication that's about to be released, some more guidance on with detail on the precluding offences and how to follow all of that. And we will have further information following soon after on the changes and how we will work towards the NDIS aged care worker screening check. One of the things in that future state, which the NDIS have now, is the ability for providers and workers to seek those checks through an online platform. We are matching that platform. We are looking at efficiencies there. So if you are a dual provider, for example, you won't have to flick between one platform and the other. You'll be able to stay in the one platform. So I think we've heard this a couple of times already today about and Rob's just mentioned it as well, the opportunity for alignment and learning from adjacent sectors, and we've been very much doing that in the development of this work.
Thanks, Katie. I think that really brings home the message that 1 November isn't the end of making improvements to aged care. Gary, worker screening is one way that we check who's operating in the sector and keep older people safe. Can you explain how the Commission goes about managing worker misconduct and how you decide whether something needs to be addressed with a provider or whether it's something that we focus on an individual worker about?
Ultimately, the responsibility for delivering safe and quality care rests with the provider. And so our starting point for a matter that is that comes to our attention in the course of care delivery, we would start with the provider. And we'd be looking at whether the provider's systems in relation to the conduct of a worker are suitable to have given them a good chance of preventing that misconduct. So did they go through the reasonable checks of the employee before they put them on board? What was their training? What's their supervision? Are they monitoring signals in employees' behaviour? So someone who displays aggressive use of language repeatedly, that might be a signal that they could at some stage use physical aggression. So we are trying to understand what the provider has done to help ensure a safe environment. But of course, we also think about the suitability of the worker, and for those that we take a view not suitable for further work in the sector, we do have fairly strong enforcement powers. That includes the potential to issue banning orders. Those can be time limited or those can be permanent. And indeed, if we see workers continuing to try to pursue work in the sector despite being on the banning list and using methods to get around that, we can pursue civil actions to try to have that enforced. So it is a start with the provider if the incident relates to care. I would just add, if we become through our intelligence aware of conduct relating to someone who is working in the sector but has not yet resulted in misconduct in the sector, so they might have been involved in misconduct in another sector or elsewhere in their life, if we become aware of that, we can commence an action that could lead to a banning order, even though they might never have worked in the sector, they might never intend. If it's bad enough, we'll look to make sure they just can't.
Thanks, Gary. Michelle, I'll go to you now. You need to consider workers from a couple of different perspectives as well in the complaints process. So complaints made by workers and complaints that are made about workers. Can you tell us a bit about how you handle complaints that involve individual workers and how you manage complaints that are made by workers themselves?
Yeah, thanks, Mel. Talking about complaints about workers, all workers and providers and responsible persons are subject to the Aged Care Code of Conduct, as we've been talking about. So when we investigate a complaint about a worker, there's a number of factors that we'll consider as part of our work in the Commission. We look at the level of risk, the severity of the incident, if there's been an incident, what action the provider's taken, and what response the worker has provided to us as well. So where a regulatory response specific to the worker is required, it might include a caution letter or a reminder letter or even a banning order if it's a very serious matter. The new Act will give us some enhanced role in relation to workers, in that we'll have explicit jurisdiction over the actions of workers, and we'll be able to investigate their actions as part of our work at the Commission. So we're preparing our staff for that new role now, and really looking forward to engaging with the sector on that topic as we take on that new responsibility. You also asked about complaints by workers. So anyone can raise a complaint with the Commission, including workers in the aged care sector. So when a person raises a complaint with us, they're given a choice whether they want to make that complaint an open complaint where we would share details in full with the provider, but they also have the option to make an anonymous or confidential complaint where we wouldn't disclose the name of the complainant to the provider. A complaint made by a worker just follows the same process as any other complaint, but complaints by workers are a really important source of information for us, and we'd encourage anyone who has concerns about quality and safety of aged care to raise that matter with us, and that includes workers for sure.
Thanks, Michelle. I think complaints is one area where we're really seeing a lot of improvements post-Royal Commission, and hearing a real change to the attitude of complaints. Katie, complaints were considered by the Royal Commission, and there was a lot of feedback about complaints during the consultation process on the legislation as well. Can you tell us what some of those important features are in the new Act?
Thanks, Mel. And we have heard lots about complaints already today, and the previous panel talked about how important they were. The Commissioner mentioned it this morning, that there's nothing to be afraid of there, that they can actually be a good signal that there's good engagement and people feel confident to raise things. I might also give a plug, because it got mentioned before lunch as well, to the consumer advisory bodies. So that was a reform that my team actually helped deliver a couple of years ago, and I think they're a really fantastic opportunity and a rich opportunity for that kind of engagement within a service. So really important connections to communication and complaints, and I think if there's that good engagement in a body like that, the consumer advisory body, then hopefully from a provider perspective, you're hearing about things before they develop into a complaint. So there's a real opportunity there to have a preventative kind of approach. There was a lot of feedback on the consultation draft of the Act, and it was along those lines of making sure that there was a prominent place for complaints in the legislation, and importantly that people wanted to see the Complaints Commissioner having a direct voice to the Minister, and that was certainly a recommendation from the Royal Commission as well. I think that's meant that we've had to be very mindful and careful about crafting the legislation and how those two positions work together in concert, and how that role is very much part of the Commission, but recognising the independence and the voice that they have independently to the Minister. So certainly we have made sure that the Complaints Commissioner is a statutory role within the legislation. We've also introduced some interrelated processes on feedback. I think you heard feedback mentioned before lunch as well, along with complaints. So feedback is a really important mechanism. Again, it's that continuous engagement and communication, but it's recognised by the Act for the first time, so I think that's really important. Some new timeframes have been introduced, both for acknowledging receipt and the resolution of complaints, and also referral to other bodies where there may need to be referral if there's issues that are raised, and very specific requirements about communication with the complainant. So I'm very happy to say that we've worked very closely with the Commission in the development of that framework, and one of the key pieces of feedback really was around transparency. People wanted to understand if they're making a complaint, they don't want that complaint just to fall into what there was a perception of it falling into a black hole, when the reality was lots and lots of people behind the scenes were doing lots and lots of work around that. So we've really looked at making that process more transparent, as transparent as possible. Thanks, Mel.
Thanks, Katie. Talking to some providers yesterday, it really struck me that the Commission is on the same implementation journey as a lot of providers are. And Michelle, I'm going to ask you a question now, but I think a lot of providers are probably asking themselves this very same question. So how do we make sure that people feel safe to come forward with complaints? And how do we make sure that the Commission can be trusted to listen and help resolve issues?
Yeah, this is such a big issue, isn't it? Because we are talking about rights, and fundamental to rights is being able to make a complaint, and yet we understand that older people don't always feel safe to make a complaint. As I mentioned, anyone can bring their concerns to the Commission at any time. So it doesn't have to be the older person themselves. If they feel more comfortable having someone talk to us, then that's okay. There's no wrong time to raise a complaint. It might be that the older person doesn't feel comfortable raising it with their provider at all, or that they have already done that and are not happy. So they can come to us at any time. It's important to know that complaints can be confidential or anonymous, and that goes for everybody, not just workers, as I was talking about before. So they don't have to have their name attached to the complaint. The Commission's complaints handling process really tries to give older people, their supporters, providers and aged care workers an opportunity to work together in a restorative way. It's not a punitive process. That's not the point of it. The point of it is to help the older person understand what is possible for them and sometimes what's not possible for them. And we need to work together to help people understand that and to be able to make sure that there are good relationships maintained, even though someone's making a complaint. The new Aged Care Act really puts older people and their needs at the centre of aged care, and we've talked about this already today. When an older person makes a complaint to the Commission about a poor aged care experience, we need to remember that that in itself is expressing their rights under the Statement of Rights. And so as providers, it's incumbent on you to encourage and assist and participate in people raising their complaints, because that is actually an expression of their rights. As the national regulator, it's a priority for us to ensure that older people who use aged care services have their rights respected and upheld. And it must also be a priority for providers and workers in delivering aged care. And I can't stress enough really the importance of frontline workers. If you're really serious about creating an environment where people feel safe to complain, then your frontline workers need to understand that it's okay for those people to complain and sometimes complain about them. So it's really important that work that you as providers are doing with your staff at the front line. Looking at always from our perspective and as a provider to try and understand the issue from the older person's perspective and the outcomes that they're looking for. We really want to get to the bottom of what it is that's gone wrong for them and really look at the outcomes that they're looking for. And as I said, they may not always be possible to achieve those outcomes, but understanding and communicating around what it is that's gone wrong for them and the outcomes that they're looking for is really the key, I guess.
Thanks, Michelle. I'll move on now to some of the questions that have come through from the audience. The one that came up first for me was, why have so many requirements been delegated in the rules? And I don't know, as the facilitator of this panel, are you expecting me to answer this question, or can I hand it over to the department now? I'll start, and then Rob, Katie, you can maybe add to it. I think yeah, it's a legitimate question. Like the kind of high level answer to that is that it's a legislative design principle that detail goes into delegated legislation rather than in primary legislation. And we all know the Aged Care Act's already a pretty long document. The rules are pretty long too. So you can imagine if we put all of that into one bit of legislation and took that through Parliament, what that might have looked like. Another key reason is that when you put things in delegated legislation, it does give you some flexibility to make changes more quickly than if it's in primary legislation. It still has to go through a scrutiny process in Parliament, but does mean that we've got a bit of flexibility, which we really need in this time of reform, to make sure that we've got things right so that we can change things where they're not quite right. Rob, Katie, I don't know if you want to add any ideas to that, but yeah, they're my thoughts.
Yeah, I won't try and add to your legislative drafting expertise, Mel, but I think it's a good hook for me in terms of how we in the department intend to use that extra layer of flexibility that having things in delegated legislation provides. We're very committed to, conscious of, as Gary's articulated for the Commission, that we've got a responsibility to have that same role around continuous improvement in the sector. And for us, that's monitoring and making sure that the system that we've set up in terms of the obligations for providers is actually achieving its intended outcome in terms of quality, safe care for older people and in terms of supporting continuous improvement and excellence for providers. And so we're building a system that will let us monitor across 5 domains how the regulatory model is landing. Is it striking that balance between protection and encouraging continuous improvement? And then we can use that to make tweaks to the rules if we need to get that balance closer to order.
Katie, anything to add to that?
No, nothing to add. That was perfect. 2 perfect answers.
Thanks, Katie. This might be a question for you, Sarah, and I hope I'm not stealing any thunder from this afternoon. But with the new Act coming into effect from November, what's the Commission's perspective on the existing applications in process? And what's the message to new entrants for both aged care and home care about when to apply, before or after the Act is implemented? And Rob, you might have something to add to that question as well.
Thanks, Mel. So we obviously have applications that we're dealing with at the moment, and I think we are pretty close to ticking over to being 90 days until the start of the new Act, and we have a 90-day statutory timeframe on completing of those applications. So we're not that far off from having the potential that we will have live applications that we may not have completed by the 1st of November. So there are transitional provisions that allows any on-hand applications that have been received under the current Act to be considered applications to be a registered provider under the new Act. What we'll do with those applications is, first of all, we'll tell people as we're starting to come towards the transition time. And then what we'll do is seek additional information from them. So that'll be information about things like which registration categories would you like to be considered to be registered into, and if there are gaps in information, we'll come and seek that information from them as well. But we'll know from a reasonable way out that we think we're going to have applications transition over, and so we'll be talking with applicants as we go through that. As to whether applicants choose to apply on this side or the other side, I think that's very much up to people. If people are approved as providers pre the 1st of November, my very lovely colleague Rob here in the department will engage in the deeming process, which will shift them into the new regime. There are some variations, so on the other side of the 1st of November, there is that audit requirement at market entry for people wanting to register into CATs 4, 5 and 6, which doesn't exist at the moment. But equally, for people who might want to be wanting to register, probably not so much into Resi, but into categories 1 to 5, because it's a more proportionate process, it may also be a bit more of a simpler process on the other side as well. So there's probably some swings and roundabouts there.
Thanks, Rob. Anything to add to that?
That's pretty comprehensive.
Okay, great. All right. I've got a really good question here, which has come up in a few conversations now, and I'll open it to the panel for who might want to address this. The question is, can you advise about associated providers, contractors in home care, and expectations for worker training and compliance? Understand about police checks and code of conduct, but what else is expected? And the person has also asked, or could we address that at a separate session or in a document? I'll just plug the session that I'm running tomorrow on governance, which we will be talking about exactly some of these issues. But anyone on the panel want to make any comments in relation to that question now? Go ahead, Sarah.
And again, we may well cover this at 4 o'clock. That was another shameless plug. I think the expectations around associated providers are pretty identical to what they are now, which is that we expect you to have processes in place to ensure that the care delivery or the services that they are delivering on your behalf, you retain responsibility for all of your obligations under the Act. So to have pretty comprehensive arrangements in place for how you're going to assure yourself that they understand what those responsibilities are and that they are meeting them. And indeed, if you happen to have had a look at the registration or renewal form, which I'm sure you all are in your spare time, a lot of that form is around associated providers and talking about those kind of arrangements that you have in place with them as well. There are also some reporting requirements around associated providers. So obviously information is given at point of registration and then point of renewal. But there's also some requirements to let us know through a change in circumstances process. And it's in relation to a number of things. So generally, you've got responsibilities to let us know if something sort of materially changes your registration, but there are also specific responsibilities around if you're delivering services in CATs 4, 5 and 6 and an associated provider either starts or stops delivering services on your behalf in relation to those registration categories, you need to let the Commission know.
Thanks, Sarah. Anyone else want to add to that? No? Okay. Rob's pointed out to me that we have someone on the stairs wanting to ask a question. I unfortunately can't see because of the lights, but if that person would like to ask their question.
Hi, my name is Barbara Kimber. I'm from Purple House. We're an Aboriginal owned and directed organisation. I guess I just want to flag and ask, what are the learnings from the NDIS worker clearance? Because when it got introduced, and I still believe today, the backlog to actually get a worker clearance assessed was 6 months. We're very proud and we cease to exist without our First Nations employees. So there is a suggestion that everyone has access to the ID requirements, online resources, money to pay for these things. Otherwise, it's the organisation, which we take pride in, will always do. However, while we're waiting for these checks, we need to make sure people in risk-assessed roles are supervised. So we've provided multiple case studies. We've had people up to 2 years because their names need to be changed on their birth certificate, because their date of birth don't match other ID, because their names are different. So how are we meant to ensure that we have culturally safe assessments of people's employment when you're saying we need to supervise people for up to 2 years in risk-assessed roles if they don't have a clearance? So what learnings have happened from NDIS worker clearance?
Thank you for the question. Yeah, thank you. Katie, I know that you've been giving a lot of thought to worker screening and First Nations workers and First Nations providers. So would you like to address that question?
Yeah, thank you. And thank you for the question. So, and specifically you've asked, what are the learnings? And we have worked very closely with our state and territory partners and the worker screening units, and many of you would know if you've working as a dual provider that there's different departments in different states who manage this. So we have taken on those learnings, and one of the positive proactive things we've decided to do is to make sure that there's a reasonable transition time. So for that future state that I was describing, it won't just have a start date and everyone must comply on that date. The proposal for transition is that the police certificate will continue and the new check will only be required when the police certificate is about to expire in that 3-year period. So we are trying to address, so one of the drivers behind what you've described is volume. So we certainly heard from states and territory worker screening units that they didn't want a process where they were swamped with lots and lots of applications at the same time. One of the other potential drivers for what you've referred to is the fact that each jurisdiction has its own rules around working with or without a check cleared. So you can put your application in, and in some jurisdictions that would require supervision until the clearance has come through. So some states call that a no card, no start requirement. So we're looking very closely at the transition to make sure that there's time. We're also looking, I think, certainly states and territories have taken a lot of those learnings on, and particularly around identification that you've referred to, and jurisdictions have got programs in place to assist Aboriginal and Torres Strait Islander people who may have difficulty accessing identification documents. And the other piece of work that we plan to do is around looking at barriers and practical solutions for Aboriginal and Torres Strait Islander people. And that might be different in a metropolitan area versus regional and or remote. So we're looking at, subject to the rules of procurement, engaging and doing some work with communities to understand what other practical solutions could be adopted to minimise any delay or disruption and the sorts of issues that you've just referred to. But very happy to, I'd like to catch up with you after the session.
Yes, please.
And and take your details, because as I said, there is a runway for this. So the more that we can plan and prepare, the idea is not to disrupt service provision, but to prepare for it. Thank you.
Thanks for the question, and thanks, Katie. Gary, I have a question for you, which is a really great one. One of our advisory council members, Valerie Braithwaite, talks a lot about relational regulation, and Rob, you mentioned relational regulation. This question is, what does working alongside you look like in practical terms? Gary mentioned this. How do you support a struggling provider?
So under our new regulatory model, there are different levels of supervision and engagement that we'll use. And you'll have seen that on the regulatory diamond this morning. And for example, you'll have seen that at the lower end of the diamond, heightened supervision is where we have the greatest level of concern about a provider. That doesn't necessarily mean the provider is deliberately doing something wrong or being negligent, but they will have hit a situation that we are very worried about. It might be a sudden financial crisis that has the risk to affect the quality, safety and continuity of care. And what that provider will see from us is support to seek additional emergency funding if need be to get clinical advice available to support continuity of care. They might see more frequent visits from our risk-based monitoring team to help keep track of what's going on within the service and the care being provided to consumers. We might have our clinical advisory team, our clinical specialists, come out and highlight particular focus areas where there might be increased risk of a failure or a harm to a consumer. If I jump back from that more sort of catastrophic end of it, when we're coming out to do inspections, under the new model, these will be announced inspections. We'll have a more coordinated approach to dealing with providers. So we would look to do the governance assessments once for a provider, even though they might have multiple services, in some cases a very large number of services. We won't need to do that governance inspection and assessment each time. We'll do that once. You can expect to hear us asking more often than we tell in the first conversations. We'll be asking about how you're delivering against the standards, the areas that you think are going well, the areas that you think you've still got some work to do. We'll be asking those same set of questions of some of your workers, of some of your consumers. So you'll start to see that questioning approach as being a way to understand what the scenario is, how close are we to meeting the outcomes that we're all after. where are the areas that we're still making improvements? And then from there, it is reasonable that we should help you with identifying resources we've made available that will make it easier for you to close the gap, or give some tips on what else you could be doing, where you could get external advice. And then, as I said, from time to time, we'll need to deal with notices and requirements and step that up a little bit more. But there'll be a lot of opportunity along the way for us to help support that, and that's what that working alongside really means.
Thanks, Gary. Rob, did you have anything that you wanted to add about relational regulation? Because I know that was definitely front of mind for you in designing the regulatory framework.
Yeah, I think actually where my brain went with that question, which is about relationship, not necessarily strictly relational regulation, is one of the lessons that the Royal Commission had for those of us in the department, I think one of the step changes we've already seen is the responsibility we have as the department as stewards of the aged care system. And that means not just setting the rules and saying the funding and assuming providers will work it out, but having that really detailed knowledge through an expanded group of people on the ground in every state and territory, and through a specialised team who do work with providers that are struggling financially, to understand where are their challenges in the system and to work beside you to respond to those in an appropriate way. And that works, I think, really well with the Commission's functions that Gary's just described, bringing together how can we support you in the quality of care, how can we support you financially if that's what we need to do, but also how do we understand at a whole of system level, how's the market working, is it a stable, viable, investable market?
Great answer, thank you, Rob. Michelle, I've got a question for you, which I think is also a good one. It's what will be different about complaints in practice from 1 November? And I think this question is interesting because I know since the Royal Commission, even without legislative change, the Commission's been doing a lot of work to improve the complaints process and the approach to complaints. So do you want to talk a bit about that and what you think the key change is from 1 November?
Sure, thanks. And perhaps in the spirit of this session, a plug for my session tomorrow, where you'll definitely get more detail on the question that's been asked. But I think, as you said, we've been on a journey with complaints already, and I think we've moved some way down towards a rights-based process in the way that we manage complaints in the Commission. But the really big thing for us from 1 November is that it's not optional now. It's not an implicit, it's not something I dreamed up. It is actually law, and it's out there. It's an expectation. It's an expectation of us. It's an expectation of you. It's an expectation of older people. And so we are using that opportunity to go further down the track that we've been on for some time. We will be talking to complainants about rights. For every complaint, we'll be considering the rights lens around that complaint. We've made a public commitment to make sure that we're in touch with the older person about their complaint every time. And I say a public commitment, we've recently published our new complaints guidelines online. And we make that promise in there that we will always speak with the older person or their representative. We will be really focusing on restorative outcomes and open disclosure because that's really where the rubber hits the road in terms of quality for older people. We'll be listening to what it is that the older person the issue that's occurred for them and what it is that they want as an outcome, and we'll be using that as the basis for taking the complaint forward. And we appreciate, as I mentioned before, that it won't always be possible for everybody to have everything they want every time, but it is about the conversation that starts with what is it that the older person wants out of this, and goes together, working together with them and with the provider to take that conversation forward and work out what are the options, how can we best meet this person's requirements and enliven their rights, which is what the session tomorrow is about.
Thank you. And I'll address the last question to you as well, Michelle, before we move to wrap up the session. This is a tricky question because the legislation uses the term complaints and feedback. Can you tell us what the difference is? I know the panel ahead of us talked about complaints and feedback. Is there any criteria to define what a complaint is and what needs to be done for a complaint? Katie, you might have views on this too. So, yeah.
So I think the simplest way is to differentiate between the two as some feedback, you know, common use of the term. I want you to know something, and I think this to be different for, you know, my family member, or if it's the consumer or other people. So I don't want to take this further, but I want to give this feedback and I want to know that it's been received. So I think that's like the simplest way I could describe it. And what we did hear from a lot of people was that they didn't necessarily want to formalise and go through a formal process. Not that a complaint making process is difficult. We've tried to, and the Commission have done a great job of that, of making it less complicated. But it's a simple communication of this isn't okay and I want you to know that I'm not happy about this and here's my feedback. And it might extend to wanting to know what's been done about that feedback, but it doesn't take the form of a full-blown complaint. So we were intending to try and draft to capture that circumstance as well.
Yeah, I really agree with what you're saying there, and in the Commission that's really what we're looking at implementing in administrative terms, is a complaints process that follows the process that you're probably all familiar with, probably been involved in previously, but also expanding that to say, okay, if you just want to tell us something, if you're just worried about something that you've seen or heard, you're worried about the safety of older people, you can just give us that feedback and we'll include that in the intelligence that we assess when we look at that provider's performance. We'll include that in our risk assessment. We'll look at what action we might need to take. Might be something quite urgent. Some feedback might be about very serious matters, and some feedback may not be so urgent or serious. And you've heard us talk already about proportionate response, and so feedback will be treated in that similar kind of way, but not necessarily, as Katie said, having to follow through that quite rigid, I suppose, complaints process in many ways, which the old legislation tied us to. So we'll have a bit more flexibility and can take broader information on board.
Thanks, Michelle. All right, well, we're ready to wrap up the session now, I think. So I might just go to 4 of the panel members. I'll skip you, Sarah, since you've given everyone a teaser for your session this afternoon. But Gary, I'll start with you. Like, if you just want to leave the audience with a couple of key thoughts on regulating under the new framework, what would they be?
I think I've given the commitment to fairness and proportionality enough time, so without sounding like a broken record, I'll move to 2 positive reflections. First being the pitch for my own panel tomorrow, and the positive there is you won't have to listen to me very much. I have 3 exceptional sector panellists who will share their insights. I think the thing I'd like to draw out that's a little more positive is, instead of talking about how we're going to deal with the bottom half of the diamond, how we're going to deal with improving practice and compliance and enforcement, remember that we do have the top half of the regulatory diamond, and we are going to be looking for examples of better practice, great practice, safe quality care that's got the person at the centre, that works for providers, that works for the sector, that works within a regulatory framework. And I'm really looking forward to being back here next year and to have a session where we can draw out some of those success stories, where we've found a way to deliver a new standard of care for a person, delivering something that at the moment maybe we think is going to be too hard. And then we'll have some of those as case studies and we can pull out and show how the person, their supporters, the service, workers, providers and the regulatory system all pulled it together and that the dream has become real.
Thanks, Gary. Michelle, any key thoughts you want to leave?
Yeah, I'm going to be really quick, and you might hear me say this tomorrow as well. I think get rights right and complaints will follow.
Yeah, great thought, Michelle. Thank you. And Katie, anything you want to leave people with on worker regulation?
2 quick things. I'd say, following on from Michelle's point, advisory bodies, you know, the consumer advisory body, really have a think about that, and is it working for you? Is it something that you have or don't have at the moment? How can you think about that as a preventative heads up and avoid, you know, prevent complaints kind of opportunity? And the other thing is just to start to think about worker screening as part of your workforce planning. I didn't mention, but the new check in the future will last for 5 years. So it's a real opportunity to start to kind of think about it, not as ticking a box, but as part of a cycle and your ongoing planning.
Thanks, Katie. And Rob, your words of wisdom?
Oh, no words of wisdom. One thing I should have said and didn't was to really call out in the new registration model the change in the focus of regulation from the service to the provider, recognising that the decisions that are made at a whole of organisation level will impact the service. And so as you engage in the new regulatory model, think about that step change. And I guess an invitation from me to conversation over the next day and a half. I was really struck by Anne's point earlier today that a lot of what makes care really great you can't regulate. And so we've tried to build some of that in the reg model in terms of how do we encourage excellence and continuous improvement, but would love to have a conversation with those of you in the sector over the next day and a half about what more we can do there.
Great. Thank you so much to the panel for this very engaging discussion. I think we've got another panel straight up next, so if you can please thank the panel for the discussion.
Yes, look, thank you very much indeed, Mel, for facilitating that session. I mean, it was interesting, Mel, that excuse me, interesting that you described yourself at the beginning as a policy nerd, but you brought a great deal of clarity and accessibility to that policy. So thank you very much indeed. And to Gary, Sarah, Michelle, Katie and Robert, excuse me, for taking us on a journey to better understanding some key aspects of the new Act. So again, as they leave the stage, and we are now doing a very quick panel swap over, please thank our panel.